You heard of this morning, vasculogenesis and angiogenesis, and how blood vessels forms, how it grows, and some of the processes and so-called the pruning of the blood vessels from the original primordial side. We're going to talk about how human vascular system is neurovascular system is developed. Probably the next couple of talks, and then including tomorrow too. What you're going to see initial. This is Pierre's. This is Pierre Lajanias, never met, but he's the one he taught us a lot about vascular systems of the brain and how vascular disease has to be treated. This is very weird. Something. Initial, after the conception, the fertilization of egg, it implants in the endometrium. This is drawings. I took it out from the embryonic stages. Let me show you what happens once implanted in the placenta. The uterus. There's two layers. What we know is ectoderm and endoderm grows. And endoderm and endoderm is a primary layer, two layers of the embryo. And initial growth started from ectoderm, and ectoderm is actually grows as a flat plate. And in the middle of the ectoderm and AP, longitudinally, there is a primitive strip called the primitive strip. And middle of the primitive strip, there is called knot. From that layer, the cellular proliferation occurs. From that primitive knot, cell progresses up and down, which become later on notochord. And then, from the primitive strip, the cell growth is going through the layers between the ectoderm and endoderm, which layer makes mesoderm. You saw the mesoderm has important role in vasculogenesis, as you heard already this morning. As an endoderm and ectoderm grows, especially in the center along the primitive strip of the ectoderm, there more cellular proliferation occurs. And as cellular proliferation occurs in the center, this is folding inside between the layer of ectoderm and mesoderm. This is eventually grows inward, and there's a thickening of edge of this ectoderm along the primitive strip. And these two roll gradually joining together and fuses together. Once they fuse, the tube which is formed is what we call neural tube. The one which edged, which fused together, become neural crest. Okay? And then remaining ectoderm is called the surface ectoderm. As this center neural tube is actually fuses like a zipper from the center to upper and lower. So it's a fusing together, this makes a neural tube, which eventually become central nervous system. Initial neural tube is covered with called meninges primitiva. From this meninges primitiva. As you grow, you need more supply of nutrients. So there's invasivenation of many primitiva into the center, empty core, empty space of the neural tube. This eventually become choroid plexus and supplies more nutrient supplies to this growing neural tube. Okay? And then loose vascular network become more organized and supply growing embryonic tube. About the 4 weeks, middle of the 4 weeks of gestation, there is more of a primitive central nervous system and spinal cord is developing. And you have a cardiac bulge as primitive heart is developing. Initial nutrient from, as we know, for embryo is growing from the yolk sac, and then eventually from placenta and embryonic vessels are developed. Circulation from primordial heart goes to truncus arteriosus, and then becoming aortic sac. Okay? And from there, we learn a lot from Dukas Hager-Paget. She's the one who used to be, she's a not physician, she's an art student, she's a biologist. And she was working in dentist surgical lab. So she was doing surgical illustration of Dandy, who was a chairman of neurosurgery in the Johns Hopkins at that age. She became more permanent employee, and then she was more interested in the vascular systems growing, embryonic growth. So she studied a lot of specimens which was stored in the Carnegie Institute in Baltimore. And she demonstrated how the vascular system grows. Okay? So I took it out a lot of slides from her initial publications. Okay? From arterial trunk, there's a first system is growing. There's a ventral, she designated the ventral aorta. From ventral aorta, this is more of growing central nervous system. Okay? And then first aortic arch connecting to dorsal aorta. Okay? So about 24 days, few days later, what it is arterial trunk, okay? And then ventral aorta. There's a connection, initial connection is, this initial connection is first aortic arch. The further connections occur between the ventral aorta and growing dorsal aorta. This is second and third aortic arches are connecting. As the pharyngeal pouches developing to become later on head and neck structures, you can see the fourth aortic arch is now start growing in this stage. This is actual illustration what the Paget made. You can see the fourth aortic arch is started growing, and you can see first, second, third, fourth aortic arch. And then 29 days specimen demonstrated, you can see the from trunk, then ventral aorta, dorsal aorta connecting first, second, third, and fourth aortic arch. Okay. This is a lateral view, side view. This is view going up, down. This is aortic system on the lateral part, and central part is so-called ventral longitudinal arterial axis. Okay. That's the in front of growing rhombencephalon in the brain. And then there's connected also through the aortic system, through trigeminal artery, and then there's hypoglossal, trochanter 1, trochanter 2. Okay? she illustrated aortic arteries, but we never see persistent primitive aortic artery. So Pierre didn't believe aortic artery is actually existing in embryonic stage. Okay, we heard aortic arteries, in the embryo, but Pierre never seen any true aortic artery persistence, so he does not believe that. Anyway, to illustrate this process well, what happens to this aortic system, I found of this diagram on website. I thought it's a very nice, simple way to illustrate the process is going through. As you can see, the ventral, this is ventral aorta. Okay, from the trunk, arterial trunk, you see the ventral aorta. This is dorsal aorta. First, second, third, fourth aortic arch. Dorsal aorta eventually fuses together, making one trunk in thoracic level. Okay? So, this is basic arrangement of this earlier stage of embryogenesis. You can see the trunk going out, and first ventral aorta, and then dorsal aorta connected all these arches and fuses together at the lower down. You follow so far? Okay. Then, next process is something happens in this ventral aorta. I mean the dorsal aorta. You can see the dorsal, ventral aorta and dorsal aorta is continuing. This is the third, okay, third aortic arch. And then you can see the sixth aortic arch, which makes it pulmonary artery later on. Okay, so from there, the initial Timo explained to you there's a pruning and angiogenesis and new vessel growth. The old one may not be persistent. Okay? Next one happens is regression of dorsal aorta between the third and fourth aortic arch. Okay? Between the third and fourth aortic arch, which was connected, this regression occurs. Okay? This disappears. Okay? Now we have a arterial trunk, ventral, and dorsal aorta connected through the third aortic arch. Okay, that's what we see. From the third aortic arch is become continuing to dorsal aorta. Then, from this arrangement, next step happens. It's a regression of right side dorsal aorta. Okay, between this fourth aortic arch and connected to this contralateral dorsal aorta, this disappears. So once this disappears, what you have this arrangement? Okay, you can see this third aortic arch. Okay, now continuing a fourth aortic arch, right side. Fourth of the dorsal aorta disappeared and continuing this way. Okay. So on left side, because dorsal aorta at this segment is disappeared from trunk, you can see the ventral aorta, fourth aortic arch. This fourth aortic arch is become subclavian artery on the right side. Dorsal aorta, the ventral aorta on this segment until this become brachiocephalic artery in the only leg. Okay. Part of dorsal ventral aorta coming from trunk, this is ascending part of aortic arch. Okay. The ventral aorta is becoming, on the right side becoming common carotid artery on the right side, and this becomes left common carotid artery. Okay? Remaining fourth aortic arch, which was connecting from ventral aorta on the left side to the dorsal aorta, this becomes aortic arch. Continuation of dorsal aorta is becoming thoracic and abdominal aorta. Okay? So left side, that's how we make it aortic arch. Okay? Ascending aorta, which is part of trunk, and then becoming ascending part of ascending aorta is part of left dorsal aorta. Right ventral aorta become brachiocephalic artery or innominated artery. Okay. Remaining fourth aortic arch on the left side become aortic arch. Okay. And then continuing to descending aorta. Okay? It's clear? Alright? So remember, fourth aortic arch on the right side becomes subclavian artery. Ventral aorta on the right side is common carotid artery. And vertebral artery develops later on. On the left side, the seventh intersegmental artery, we'll talk about later on, intersegmental artery becomes left subclavian artery. Okay? So embryonic origin of right subclavian and left subclavian is completely different. Okay? So we finally form, I need to show you this. We finally form this aortic arch, okay? Usual aortic arch, what we see is innominated artery, left common carotid, left subclavian artery this way. Okay? We often call this common origin of right and left innominated artery and left common carotid artery is a bovine aortic arch. Okay? But it's not true bovine aortic arch. We should eliminate this called bovine aortic arch. Because bovine aortic arch is usually one trunk goes up and divides everything. Okay? So this is not true bovine arch. So this is true bovine arch. We often see some of the variations. Okay? From there, sometimes this fourth aortic arch may regress early. If this regresses, somebody else has to be supplied distal territories. Some other pipeline has to go in there. The other pipeline is what? This, instead of this, it regresses this fourth aortic arch early. So remaining dorsal aorta become subclavian artery. That's what forms this way. So that's what we call, what do we call this? Aberrant subclavian artery. Okay? Aberrant subclavian artery is earlier regression of fourth aortic arch. Okay? So remaining dorsal aorta, okay, is supplying or becoming subclavian artery. This is aberrant subclavian artery. Okay? Aberrant subclavian artery is going through from the descending aorta, distal to the left subclavian artery, going through behind esophagus and trachea and going to the right side and become origin like this. This is frontal projection and this is posterior projection of this CTA reconstruction. Okay? This is again same thing, behind it, okay, and going through this behind the esophagus entry. Sometimes this is rare. However, you can have a complete separate origin of subclavian artery. Okay? Probably this is shortened of ventral aorta on the right side may give a separate origins. Okay? Since we know fifth aortic arch is not existing in humans, it's easier to explain the fifth aortic arch, but we don't have fifth aortic arch. So what I believe is because of shortening of this ventral aorta on the right side makes this unusual examinations. This is what do we have here? Aortic arch, innominate artery, and then one trunk give left common carotid artery and left subclavian artery this way. Okay. How it happens? What I thought it happens is early regression of ventral aorta between the third and fourth aortic arch. So you have a common origin of the common carotid artery as well as subclavian artery on the left side. This is my interpretation of this variation. Look, what we have this variation. We have a innominate artery. We have a separate origin from internal carotid artery and external carotid artery, separate origin from subclavian artery or innominate artery. What I think has happened is probably early regression of third aortic arch. So you have this external carotid artery and internal carotid artery is from separately from the subclavian arteries. Okay? So there are something may change during vasculogenesis and angiogenesis process. Okay? This is what? What do we have? Aortic arch is supposed to be, descending aorta is supposed to be on the left side. But descending aorta is on the right side. Okay? So this is right-sided aortic arch. Complete reverse, but similar to subclavian artery, aberrant subclavian artery. This is configuration of aberrant left subclavian artery because the artery is on the right side. Okay, always you have this like a diametrical dilatation when you have a left side subclavian artery originate from descending. This is exactly right side aortic arch because this is regressed and the subclavian artery is coming from upper side this way. Okay, complete opposite arrangement. Okay. How about this one? We have ascending aorta, then same thing, descending aorta is on the right side. Ascending aorta, this must be ascending aorta. This is descending aorta. Situs inversus. The completely upper side is not subclavian differs from this right aortic arch. So there is no aberrant left subclavian artery origins. Okay? This is aortic arch is double. Okay, the one supposed to be regressed did not regress, it persisted. So there's a double aortic arch, you can see it. And left side vessels originating and anterior, and the right side is posterior arches developing this way. This is two separate double aortic arch. Okay. And sometimes when you try to treat this, a stroke patient to go in to retrieve, treat this stroke, you may have difficulty finding the origin of the vessel center from the aortic arch. So once you know how the arrangements are, you can actually go selectively. It's easier than the other side. This patient, had some non-specific symptoms, and he came in with this MRI on the vein. Okay? You can see all the vessels. Okay? What is unusual? We have a right side illuminate, so clavate, carotid artery is okay. What is unusual? One of my colleagues was presenting at our weekly conference, and I looked at it as something wrong with it. Bovine arch? Bovine arch you see the pulmonary artery is supposed to be above. What's happening in beyond this point of the aortic arch? Coarctation. It's good thought. There's no descending aorta. Right? No descending aorta. There's a lot of vessels around the neck. This is interrupted aortic arch. Okay? Usually interrupted aortic arch, usually patient does not survive. Child does not survive, but this patient had collaterals, extensive collaterals to the descending aorta, that's why he was able to survive. Okay? So, look at this initial diagram and see what process you can go through. Okay? And then you can figure out any abnormal configurations. About the vertebral artery origins, we do have a segmental arteries, about 30 branches of paired segmental arteries go through the somites to develop somites, and eventually it become intercostal arteries, lumbar arteries, and sacral as a lateral sacral arteries. Okay? These segmental arteries persist in the cervical area as well. If you look at cervical E diagrams, cervical areas, initial supply was coming from, I mentioned, trigeminal, hypoglossal, parotidal 1, parotidal 2, then third and fourth segmental arteries. Between these segmental arteries, there is a longitudinal anastomosis occurs. Especially in cervical level, this longitudinal anastomosis eventually connecting and making vertebral arteries. Okay? Segmental arteries, okay, we are at the metameric origins. Metameric origins, these segmental arteries become supplied to the central nervous system, okay, peripheral nervous system, muscle, or skin. All the segments of the specific segments is supplied by this segmental arteries, paired segmental arteries. That's why you can see the anterior spinal artery is originated radiculomedullary artery, okay? The radiculopial arteries as well, okay? As this fuses together, and C1 level what do you see? The C1 vertebral artery is connection through proarterial 1. This is proarterial 1 artery, which is connecting from cervical, the intersegmental artery, to developing ventral longitudinal artery, which becoming basilar artery. Okay? C1 segment of vertebral artery is coming from proarterial 1. Right? So that's the development of vertebral artery. So we have segmental artery developing from 7th intercostal artery. Segmental artery fuses together all the way left side. It originates from the 7th intersegmental artery. And right side as well. You have intersegmental artery fuses to become 7th intersegmental artery, which later become, we mentioned this portion of subclavian artery is what? 4th aortic arch, right? In continuing to in 7th intersegmental artery become continuing as a subclavian artery, and vertebral artery is originating from that time. What happens? Sometimes we see vertebral artery originate from aortic arch. You can see the aortic arch origin of vertebral artery. Why this happens? The reason is, suppose this intersegmental artery on the left side continuing to the 7th intersegmental artery connections, but this does not happen. So 6th segmental artery continuing to as a vertebral artery. That's why aortic origin of vertebral artery at this level. Sometimes you've probably seen double vertebral artery origins. One of those supposed to be regressed, but did not regress and persisting in making connections this way. So you see the double origin of vertebral artery. This is another example. So subclavian artery injection, you can see 1, 2 origins of vertebral artery. This is lateral view, and you can see the joining together. This is again double vertebral artery. 1 is prop 6. This is prop 7. And joining together in this way. So 6th is directly originating from the aortic arch. This is left vertebral artery from descending order, not subclavian artery. This subclavian artery here, but originating from lower down, from the descending order. This is probably go down, did not connect it to subclavian artery 7th. So 8th segment or T1 segment is continuing, become vertebral artery. You can see the vertebral artery originating from there. This is unusual, right? Vertebral artery. It's a complex process, but I think it's probably one of connections did not happen from this. Connections did not happen, so remaining dorsal aorta is becoming continuing as a vertebral artery. This is segmental artery of thoracic T1 or T2 with continuing become a right vertebral artery in this way. One last thing I'd like to mention to you is I mentioned it. It's metameric origin vessels, segmental arteries. From the metameric origin vessels, continuing to connections, major one is vertebral artery. The other segmental arteries and the other origins are ascending cervical and deep cervical arteries. So sometimes you may have common origin. You can see that from vertebral artery, it gives off ascending cervical and thyroidal branches also. Okay? From subclavian artery, okay, is a vertebral artery, but not on the thyroidal branches. It's coming from main trunk of the vertebral artery itself. You can see this one trunk coming from directly from the aortic arch. You have a thyroidal branch, vertebral artery, and deep cervical artery branches like this. So, metameric origin vessels, vertebral artery, ascending cervical, and deep cervical arteries could be connected, and sometimes vertebral artery may enter not C6 level, but you can enter C4 or C5, okay, to the transverse foramina. So that's because of this metameric origin of this arrangement. Okay? Any questions?
You mentioned the vertebral artery can arise from the.
Just wanted to confirm, you mentioned vertebral artery can arise from the descending aorta. So is it arises directly from the descending aorta or the segmental arteries? Does the vertebral artery from the descending aorta arise from the segmental arteries, the intercostal arteries, or directly from the descending aorta?
The vertebral artery, we are talking about right side or left side?
Left side.
Left side. Left side, the segmental arteries are right and left side.